we have a guest with us in the studio today to discuss more on the updates on the measures, challenges addressing health professionals and other issues on COVID-19. Edith Uwugiaren, Assistant Director, Nursing Services Department, a nurse midwife, bronze and plastic nurse, and a public health nurse. Madam, thank you very much for honoring us today. So let's start off with this question. How do we maintain good respiratory hygiene now?
Maintaining good respiratory hygiene, there are a lot of things that we can do as individuals. First and foremost, there is this thing we call swag. If you want to cough, you want to sneeze, you do it with swag, and by that I mean you sneeze into your elbow. You want to cough, you cough into your elbow, of course with your face mask on if you know you have a cough. Reason being that we don't want your aerosols or the saliva from your mouth to be exposed in the air, not to enter the face or the mouth of any individual that is close by you. So as much as possible, we need our people to wear face masks. Our people are not complying with that rule by the state government. We shouldn't push the government to ensure a total lockdown in our state. It's simple. Even if there's no COVID-19, you lose nothing for wearing the face masks. Let us comply, wear our face masks at regular interval, maintain social distance between you and any other person you are relating with. You can see the way we're even seated at the studio, so that you can hear what I have to say. I'm not wearing my mask, she's not wearing. And we have to space ourselves. Let us comply by these simple rules and we'll be safe.
So that brings me to are there any other educative or preventive programs that should be run to make people understand what COVID-19 is and how deadly this disease can get?
What we can do in that regard is to have programs that will run in local dialects. Let people hear in their native languages. A lot of doubt among the people, a lot of unbelief, and that's a major challenge because they don't see the reason why they should wear masks. A lot of persons are complaining about what government have done, what government hasn't done. We need to talk to them in their local language because if maybe the English we are speaking is what is making them not to understand, let's do program in Edo language, in Igbo language, in Hausa, local dialects that will drive home the point because what is happening is real. If we allow death to begin to occur in our state as we have in foreign land, we are going to have issues in our hands because we've been seeing decomposing body on the streets.
So what challenges hinder quality palliative care, to COVID-19 patients? What are the challenges that health professionals, face? Well,
the first problem that we're having now is stigmatization. A lot of stigma attached with it. In our local environment or communities where we live, people say, oh, my husband visited, they've got to my neighbor. How are they? And he's like, your wife working UBTH. As if we don't want to see you, that kind of a thing. And even among health workers, some of us have this phobia for the virus and we stigmatize those working in those units. It's quite a challenge. We need to encourage one another in times like this. If I back off the way the other person backs off, who nurses the patient? Yeah. Who manages the patient? So it's our collective responsibility. Let us join hands and give the support that we can get. Then for PPEs that we wear, we can never have enough. Anybody that have the means of giving more to the state, to give more to the hospitals managing this
private individuals now and other organizations.
Anybody that can, anything you can do to be of support, to add value to the system, the time to help one another is now.
No. So what steps can, doctors and other health professionals take to stay healthy during this COVID-19 pandemic?
We need to boost our immunity as individuals. We need to eat well. We need to rest well. When you're on time off, ensure you take maximum rest so that you don't wear yourself out. Then avoid fear as much as possible. Even the Holy Book says, fear has torment. The first thing to believe in yourself. You will not have it. Have that confidence that you are able to pull through this. But if we entertain fear, all of us will go down, even before the COVID comes.
So what's your general advice to the public now?
Nigerians, my Edo people, you lose nothing by wearing face masks. You lose nothing by staying at home when you ought to stay at home. We shouldn't push the government to lockdown. Wash your hands regularly with soap and water. I was coming here this evening. I wasn't sure what to meet. I had my sanitizer in my bag. Buy, protect yourself. Stop asking what will the government do for you. What are you doing for the government? Help yourself. If there is a death in your family, no government official is coming to your house to mourn. If you lose your sons, you lose your daughter, you lose for yourself. Let us help ourselves for ourselves. It is about you, not about government. Protect yourself. Edo State, we have children abroad in Italy. Edo is the second home for Italians and those from Spain. We have our children there. They should tell us what is happening. That is a word they say is enough for the wise. Prevention is better, safer, healthier than cure. Stay safe.
Thank you. That's the message there. Stay safe. Thank you very much,
Thank you.
Mrs. Edith Uwugiaren, for honoring us today.